Hello everyone. In this video, we are going to introduce the spleen. The spleen is located in the middle jaw, in the region between the diaphragm and umbilicus. The spleen meridian connect to the stomach, and the orifice is the mouth. And when you see here the meridian, each Zang organs, we always gave you the meridians connect to which organs. These organs are considered as coupled organs. So same as the lung connects with the large intestine. This is considered, so the lung and the large intestine are coupled meridian, or the paired meridian, the paired organs. Here the spleen and the stomach also are paired or coupled organs. The main function of the spleen governs transportation and transformation. That's the first function of the spleen. The second function of the spleen controls blood in the vessels. So for the first function of a spleen, the spleen governs the transportation and transformation. The transformation and transportation of food and body fluids, and also actually the water or body fluids, all these. The reason why we say the spleen governs these two functions of transportation and transformation, that's actually because the spleen receive the food. The spleen and stomach receive the food from the mouth, esophagus, and then the food goes to the stomach. The spleen will receive them and absorb them. So the function of the stomach to digest food, in Chinese medicine theories, we think that the stomach function is under the assistance of the spleen. Without the spleen, the stomach won't be able to digest. So the spleen can help to digest and absorb food and water fluids, which is considered as the acquired food. And the acquired food, because the foods after being digested, the spleen, it becomes acquired qi. So that's the nutrition we need, the body can use. So the acquired qi, the spleen can absorb the acquired qi and transport to the lung. Then you go back to the lungs function. In previous videos, we said the lung governs the dispersing and descending. So the spleen will absorb and digest the food, the qi from the food, and then it transports to the lung. The lung can disperse this kind of qi over the body. This kind of qi is the acquired qi. That's part of this kind of qi is the nutrition, and this kind of qi also can be transformed into essence, qi, blood, body fluids. So that's why we said the spleen governs the transportation and transformation of food. The transformation and transportation of body fluids is quite similar. The only difference is when we talk about the food, or now we talk about the water. So the spleen also absorbs the water and transform into qi, and then this water qi going to transport to the lung. The lung going to disperse all these body fluids, all this water through all the body, and this also relating to the function of the lungs function, dispersing and descending governs the qi as well as governs the waterways. So as you can see, the function of the spleen, actually, in order to function well, the spleen needs the function from the lung as well. So that's the transportation of the body fluids. And that's also exactly why, because it was so important, this function of body fluids. That's why if the body fluids, if the spleen lose the function of transformation and transportation body fluid, you will cause the phlegm, which becomes the pathological changes in the body. That's because of the spleen loses the function of transportation and transformation of body fluids. And in this condition, exactly because of this reason, that's why we say that the phlegm is come from the spleen, not from the lung. Although when we have phlegm, we will cough from our lung, but in Chinese medicine theories, we think that the phlegm is from the spleen. The originates from the spleen. That's exactly why in the treatments for phlegm problem, we will treat the spleen as well as the lung. There's one very typical example is that there's one acupuncture point in your leg. If I'm not wrong, it's stomach 38, because I'm not familiar with the numbers, but the Chinese name is Fenglong, so it should be stomach 38. The stomach 38, that point is one of the key points, acupuncture points, of clearing phlegm. But as you can see from the stomach meridian, this point sits on the stomach meridian. Why it sits on the stomach meridian? That's because of stomach and spleen are coupled organs, and the phlegm originates from the spleen. That's why we use the points on this meridian to treat the phlegm instead of using the points from the lung meridian. That's an example of treating phlegm from the spleen. And these two functions, two aspects, the transformation and transportation of food and body fluids, actually they happen at the same time. While they transport the food, they also transport the body fluids. And these are actually where the acquired qi come from, or where the nutrition come from. That's why the spleen is considered as the source or the most important organs of acquired qi. In Jingyuan dynasty, if you still remember the theories, the story in the history, there's one master, he develops a school called tonified spleen school. So in his school, he believed that every disease is due to spleen deficiency. It's due to the dysfunction of this transformation and transportation of spleen. Then you don't have enough nutrition. That's why you have diseases, or you generate to certain medical conditions. So in that school theories, they use all kinds of treatments to tonify spleen in order to treat the diseases. From here, you can see how important the spleen is in our human health. The second function of the spleen controls the blood in the vessels. This function refers to that the spleen has the function to limit the blood, especially the spleen, the qi in the spleen has the function to limit the blood within the vessels, to keep the blood move within the vessels. This function mostly refers to the lower body, the lower part of our body. So if the spleen loses the function of controlling blood in the vessels, the most common condition is will cause bleeding, but this bleeding will mostly refers to the bleeding in the lower parts of our body, such as the blood in the stool or blood in the urine, or for ladies, the excess blood in the period, or blood in the muscles in the lower part of the body. In the upper part of the body, we don't consider as the spleen's function. So here the spleen controls the blood in the vessels, specifically in lower parts of the body. And now you can see the heart governs the blood. The lung qi moves the blood, which becomes the heart qi. The heart qi, which is part of the lung qi, the qi of the whole body, which is governed by the lung. And then now the spleen controls the blood to limit the blood to move within the vessels to avoid bleeding. So if someone, especially for spleen deficiency, called qi deficiency, they will have bloody stool, bloody urination. That's due to qi, especially at the lower part of the body. The characteristics of the spleen have two characteristics. The spleen governs the rise of the clear. As you can see there, I put a bracket qi. The reason why I put a qi there actually because the spleen governs the rise of clear qi. And this clear qi, because the traditional translation is only, especially in the Huangdi Neijing, it described that the spleen governs the rise of clear. It didn't tell you clear what. So that's why I add the qi there. The clear qi, we need to think about what's the function of the clear qi. The qi, especially for the qi is yang, it's considered as yang. The clear qi, when we say the clear qi, it's compared with the crowded qi or turbid qi. Clear qi is yang. Clear qi is supposed to move upwards. The spleen governs the rise of the clear qi. If the spleen loses the function of governing the rise of a clear qi, what will happen is that the clear qi will stay at the lower part of the body, which can cause diarrhea, loose stool. Also, on the contrary, if the clear qi stays at the lower parts of our body, then the turbid qi or the crowded qi will stay in the upper parts of the body, which is supposed to stay in the lower parts of the body. So in this condition, if the crowded qi stays in the upper parts of the body, then the patient will feel headache, dizziness. You see, these are the dysfunction of the spleen governing the rise of qi. So the spleen needs to in charge the proper movement of qi in the body. The spleen will transport the qi to the lung, also rise the qi to the lung. Let's govern the qi, the rise of the qi. That's the first meaning of this. The second meaning of the governs the rise of clear qi is to support the internal organs. So previously, when we discussed the blood movement, we mentioned that on the ground we got the gravity, which is yang, and that gravity is pulling everything downwards, such as the water. If you squeeze the water out of your towel or you open the tap, the water will move downwards. The water will never move upwards, right? That's because of the gravity. So same as our human body also have the trend to move downwards, especially for the organs. But what supports the organs in a certain position? In our theories, we think this function is from the function of the spleen governs the rise of clear qi. So this clear qi help to hold the organs in certain position. In other words, if the spleen loses this kind of function, the internal organs will dislocate, and in this condition, such as the stomach, the intestines, or especially the uterus will move lower. So the dislocation of internal organs. In this situation, we think that's the dysfunction of spleen. And in this kind of treatments, what we can do, we also can use the treatments to improve the spleen function, to tonify the spleen. That's the treatments for this situation. The second characteristic of spleen is that the spleen prefers dryness and dislikes dampness. This is the preference of the spleen, and this preference also can reflect in our clinical practice and our treatments. If there's excess dampness in the body, if you cause the spleen dysfunction, and also the spleen dysfunction will affect the transportation and transformation of food and body fluids, which can cause the phlegm. These theories we're going to introduce more in details in the etiologies of Chinese medicine and acupuncture. What's important here you need to remember is spleen prefers dryness and dislike dampness. So in the treatments for spleen problem, what we can do, actually we can use the treatment to relieve the dryness, and then that can help the spleen on the other hand. So that's from the theories of the spleen prefers dryness. We use the herbal medicine or acupuncture points to alleviate the dampness in the body. Then the spleen function can be recovered. So these are the main functions and the characteristics of spleen. The relationship with others vary. Vary is as the emotions of spleen. So worry or anxiety is actually quite similar situation. You see, especially for anxiety patient, someone they worry too much or they worry a lot. That kinds of patients, you will see most of them, the shape of them are actually skinny. You will never see an anxiety patient overweight or obese. Anxiety patient, or when they worry too much, most of them are skinny. That's because when they worry too much or the anxiety, This kind of emotion will affect the spleen function. When the spleen function is affected, the function of transformation and transportation of the food and body fluids, which is the nutrition, the most essential nutrition come from, the acquired qi and blood come from. It's not enough for the body. So this kind of patient will never be overweight. On the other hand, what we can see, if a person very skinny, we know we can think about their personalities. This person may be anxiety. This person may worry a lot. This person may think a lot in their daily life. So that's how we predict some certain condition. For instance, sometimes our consultation, when a patient comes into the consultation room, our consultation doesn't start with the conversation. Our consultation or our diagnostics actually starts the moment we see the patient, because from the body shape, you can find some clue from the body shape. That's how to use this kinds of theories in our practice. It will vary as the emotion of the spleen. Saliva as the body fluid of the spleen. So sometimes some patients will tell you that they have a lot of salivas. They need to spit it out, or when they sleep at night, the saliva keeps coming out from the mouth, and sometimes the saliva can wet the pillow. In this condition, how can we treat this kind of problem? So in this condition, we think most of the condition, although we also consider of other situations from the tongue or the pulse, but there's one common condition, is the spleen deficiency. So the spleen function is weak. That's why the transportation of the body fluids is not function well. That's why the saliva supposed to go to other parts of the body, but the body fluids go to the mouth, cause excess saliva, and this saliva will go out from the mouth. So in this condition, we will use the treatment to tonify the spleen to recover the spleen function of transportation fluid. That's how to treat this kinds of medical conditions. And this treatment is actually based on these theories, the saliva as the body fluids of the spleen. You see, that's exactly why you need to remember all these theories, because when you see someone sweats a lot, then you will know that the sweating is related to the heart. Then your treatment, you might think about the treatments towards the heart, although you also can treat other organs in combination according to the symptoms. And if someone got runny nose, you knew the nasal mucus is related to the lung, and then you can treat the lung. You can think about the lung, and also the nasal mucus also considered as the phlegm. The phlegm is related to the spleen. Then you can, for nasal mucus, you need to think about, especially such as sinusitis, such as the sinus. You can think about the treatment for that is you can treat in a combination of the lung and spleen. And now if someone tells you that they got a lot of saliva in the mouth, or they get excess saliva in the mouth, then for saliva, you know from the theories, saliva is considered as the body fluids of spleen. Then for the treatments, you can think about the spleen and the muscles or fleshes and the four limbs as the body constituents of the spleen. So in this condition, if some patients very skinny, and then for this kind of patient, what we can do, we also can tonify the spleen, because when patient very skinny means they don't have enough muscles. So that's the treatment for this kind of condition. The orifice, the mouth as the orifice, and the lips as spleen. So if you want to see the spleen function, does the spleen function well, you will see from the mouth and the lips. Also for the other aspects, for the four limbs, the function, the relationship between the four limbs of the spleen. In one very typical condition, if the patient have such as after stroke, they got paralyzed, so part of the extremities on one side cannot move. In this condition, or the weakness of the legs or muscles, or sometimes some patients they cannot lift up their eyelid. That's one of the medical condition. So as you can see, these are from the disorder of the muscles in this kind of a medical condition. We also focus on the spleen. The reason is because the spleen, the muscles and fleshes, and the four limbs is considered as the body constituents of the spleen. Spleen corresponds to a season of late summer. Late summer, again, we actually mentioned in the 5 elements before, but again, late summer, there's some different theories, some different debates on late summer. When is late summer? But here, especially when we use our treatments, we use the theories of late summer in the period of late summer to early autumn. This kind of period we consider as late summer. We don't consider that kind of theories as every 18 days of each seasons. The last 18 days of each seasons as late summers. We use the theories that's from late summer to early autumn, this period. That's because in this period, the weather always rains a lot. So in this condition, the climate is humid, which means has a lot of dampness. And the dampness, this kind of dampness is going to affect our human body as well. So the spleen sometimes be worse. Spleen function sometimes will be worse in this kind of weather. That's why in summer, especially in very hot and humid climate, we may feel fatigue, we may feel tired, or we may feel heaviness in our limbs, in our legs, in our arms. We do not want to move. Also, we lose our appetite. We don't want to eat, or sometimes we have diarrhea in these seasons. That's because of the spleen corresponds to the season, and then the season, the weather changes, the humid climates in this specific time of the year can affect the spleen, can cause the spleen dysfunction. So that's the characteristics and the relationship with others of the spleen. In the next video, we're going to introduce the liver. Thank you, guys.